As communities across the country try to stop the spread of the coronavirus, nursing homes repeatedly particularly vulnerable. Data from the Kaiser Family Foundation finds more than 10,000 people have died from coronavirus in nursing homes, and that's only in the 23 states that are publicly reporting death data. To make matters worse, policies vary state by state on how to handle coronavirus in nursing homes and whether those who test positive are allowed to return. With me now is the President and CEO of the American Healthcare Association, Mark Parkinson. Mr. Parkinson, thank you for being here. The first cases were in a senior long-term facility in Washington State. As you go through these daily briefings by the governors, we watch too many of them, this keeps coming up. Help a layperson who maybe doesn't understand the industry very well. Should there have been more of a five-alarm fire, if you will, at the beginning, to rush into these homes nationally and to do more to protect workers and residents?
Boy, absolutely. I mean, it's a horrible tragedy, and what makes it even worse is that we've known for 2 months that the emphasis needed to be placed on nursing homes and assisted living buildings, and it just hasn't been. Our staffs are working 24 hours, double shifts. They've been doing this for 2 months, but they can't do it alone. They need the resources to win the battle. So specifically, we need testing. We're not at the top level of priority for testing. That needs to change today. Secondly, we need equipment. We still don't have enough face masks to keep the virus from spreading. And finally, Health and Human Services now has a ton of money to attack this because of the Stimulus Act. We need for long-term care residents and staff to have a separate fund to help them, just as a fund has been set up for hospitals. If we can do these things, we can turn this around. But if we don't, these horrible tragedies are going to continue.
We could show you a map. In 6 states, deaths in nursing home account for 50% or more of their COVID-19 cases. Are these states just unlucky? Is it a regulatory thing? Is it a staffing issue?
Well, clearly the northeast part of the United States has been hit the worst. If you look at the corridor between roughly Maryland and Maine, I think because of the virus coming in from Europe in January and February, those have been hit the hardest, not just in the general population, but also in long-term care facilities. But unfortunately, this is a nationwide problem. There are facilities across the country that have had COVID positive folks in the buildings. The good news, I mean, there is a good news story to this, which is that if we have the resources that we need, we can beat this at times. There are thousands of residents that have been cured, that have recovered. And so it's not too late. It's a shame that we didn't put an emphasis on this 2 months ago, but it's not too late to fix that mistake today.
And you say testing is the biggest need, most urgent need?
Yeah, right now, nursing home residents, even if they are symptomatic, they have signs of COVID, are a priority level 2. That is ridiculous. They should clearly be a priority level 1. If you're a priority level 2, you can get a test, but you can't get results for 8 or 10 days. And a lot of bad things can happen in those 8 or 10 days. So we need to fix testing, we need to fix supplies, and we need a specific fund from HHS to attack this problem.
Mark Parkinson, appreciate your insights today. We'll keep in touch as we go through this. It's a tragedy within a tragedy.